Sinus headaches can be absolutely miserable. In this video, you'll discover the 4 major causes of sinus headaches and the modern solutions available to help you feel better. First, what exactly are sinus headaches? While the term sinus headache means different things to different people, patients often refer to any facial pain or pressure as a sinus headache. The key to success in battling facial pain or pressure is to determine the true cause. We're going to quickly cover the 4 major causes of sinus headaches. Then, keep watching and you'll learn how we figure out what the real cause is for each patient. The first major cause of sinus headache is chronic sinus infection. Take a look at this CT scan, taken looking directly at the patient's face. These arrows represent the eyes. These arrows represent the nose. And this red line down the middle is the septum. It should be straight like this. These arrows represent the cheek sinuses. They're black and full of air, which is how the sinuses should look. Now look at this scan. This first arrow represents a clear black sinus on the patient's right, with only a bit of gray thickening in the bottom. This second arrow shows a significantly blocked and infected sinus on the patient's left. This type of severe infection can cause chronic headaches. Now let's go over the second major cause of sinus headaches, septal deviation. In this scan, the septum in the middle should be straight like this line. Instead, it is bent to the patient's right, as shown here. Septal deviation like this can also cause sinus headaches. The third major cause is allergies. Look at this telescopic view inside the patient's sinus. There's a bit of deviation in the back, but notice that the tissue is pink and looks healthy. Now in this view, the sinus is red, inflamed and swollen. It does not look healthy. This is a picture we might see in a patient with chronic allergies or even a low-grade infection. The fourth major cause of sinus headaches is sinus polyps. Look at these side-by-side telescopic views. On the left, you can see the same picture as before, which shows an open and pink nose. On the right, notice the glistening object in the middle. That is a nasal polyp. Nasal polyps can also lead to sinus headaches. With various possible causes, the real key to addressing sinus headaches is understanding the cause. Here's how we do that at Texas Sinus Center. We evaluate sinus headaches by first conducting a CT scan in the office. The patient sits while the machine spins around the head for about 45 seconds. It's an easy and painless process. We may also conduct allergy testing, which is done on the arm like this. Finally, we will also do a nasal endoscopy, which is the telescopic view I showed earlier to look inside a patient's nose. So once we've identified the cause, how do we treat it so you can feel better? Treatment depends upon what we find in our testing. Chronic sinus infections may be treated with antibiotics, balloon sinuplasty in the office, or sometimes traditional sinus surgery. Septal deviation or nasal polyps require surgery in the operating room. Allergies are treated with medication or immunotherapy. Immunotherapy may be delivered as shots or with sublingual drops under the tongue. There are a few less common causes of sinus headaches. They are migraines, neck problems, temporomandibular disorders, TMB, and tooth pain. We'll look for these if we don't find anything when evaluating the sinuses. If you suffer from sinus headaches, come see us at Texas Sinus Center. Dr. Atkins has been helping people with sinus issues since 1991, and we can help you too. With modern diagnostic and treatment solutions, there has never been a better time to address your sinus headaches and finally start feeling better. To schedule an appointment, look at the top of the page. There, you'll find our phone number as well as the link to use our easy online scheduling. We accept most insurance plans and have locations in San Antonio and Bernie. Come see us and let's start you down the path to feeling better.